Quitting smoking can be a very difficult challenge, but it is possible and well worth the effort. There are many different methods that can be used to help stop smoking, including pharmacological treatments. There are many medications available that help with smoking cessation, such as nicotine replacement and antidepressant therapies. Yes, there are many available drug treatments that help quit smoking, including replacement nicotine. This includes forms such as gum, lozenges, aerosols, sprays, and chips. This treatment helps relieve the withdrawal that occurs when you quit smoking. Antidepressant treatments, such as bupropion and nortriptyline, can be used to help relieve psychological symptoms of withdrawal and improve mood. Anti-anxiety therapies, such as benzodiazepines, can be used to help relieve anxiety associated with smoking cessation. Stimulating therapies, such as nicotine and bupropion, can be used to help stimulate the brain in a similar way to smoking. You should consult a doctor before using any drug treatment, as some drugs may cause side interactions, and you must follow the correct instructions for use. Behavioral support, such as counseling with a smoking cessation counselor or joining a support group, can help identify factors that lead to smoking and reduce the urge to smoke. Yes, behavioral support can be very helpful in identifying the factors that lead to smoking and reducing the urge to smoke. Behavioral support can be obtained through trained smoking cessation counselors or by joining smoking cessation support groups. A smoking cessation counselor can help people identify when they smoke and the factors that lead to smoking, and they can provide tips and advice on how to improve coping skills in difficult situations that may lead to smoking. As for support groups, they provide a supportive environment for people trying to quit smoking, allowing them to talk to people who are going through the same challenge, talk about their experiences, and provide moral support to each other. Behavioral support should be part of a comprehensive smoking cessation plan, because quitting smoking is a personal matter and requires a lot of challenge and commitment. Benzodiazepines may be used temporarily to help relieve anxiety associated with smoking cessation. However, you should consult your doctor before using any anti-anxiety treatment. As benzodiazepines can cause addiction and habituation. And can interact with certain other medications. There are also other treatments for anxiety that can be used, such as antidepressants, which are sometimes used to treat anxiety. A doctor can also be consulted to find out the appropriate treatment for each person's condition. Stimulating therapies, such as nicotine and bupropion, can be used to help stimulate the brain in a similar way to smoking. Yes, stimulant therapies such as nicotine and bupropion are commonly used to help relieve symptoms of smoking addiction, as they stimulate the brain similar to smoking. Nicotine is the active substance in tobacco and can be obtained through nicotine replacement products such as lozenges, gums, and aerosols. It is used as an alternative to smoking and as a brain stimulant. Moreover, The correct instructions for use must be strictly followed, and the recommended dose should not be exceeded or the dose changed without consulting a physician. You should also avoid handling expired medications, and store them in a cool, dry place out of the reach of children. If any unwanted side effects occur, you should contact your doctor immediately and stop using the medication if your doctor recommends it.